Good afternoon. I'm Allison Arwady, Commissioner at the Chicago Department of Public Health. Really pleased to be able to give you a COVID-19 update. I'm joined today by two friends and colleagues, Rosa Escareno, the Commissioner at Business Affairs and Consumer Protection for the City of Chicago, and Dr. Rachel Rubin, Senior Medical Officer and co-lead at Cook County Department of Public Health. So we're going to do two things today. We're going to give a quick vaccine update, and then we're going to share some exciting news related to reopening progress in the city of Chicago and Cook County. So to start off on vaccines, 1 in 13 Chicago residents has now received at least a first dose of COVID-19 vaccine. 1 in 6 Chicago residents over the age of 65 has received at least that first dose of COVID vaccine. We're making excellent progress every day. To put that in perspective, more than 270,000 COVID-19 vaccine doses have already gone to Chicago residents, and that is more than 30,000 more vaccine doses than the total number of people here in Chicago ever diagnosed with COVID. So we're really pleased to be pushing out vaccine much faster than COVID is moving. Our efficiency goals look very good. 99% of Chicago's allocated doses have been pushed out to providers, exceeding our goal of 95%. And 88% of Chicago's vaccine doses have been administered and reported 7 days after delivery, setting aside those held for the long-term care facility program. There, too, we've met our initial goal of 85%. So I want to underscore that as quickly as we are receiving vaccine here in Chicago, we are pushing it out. We have more than 500 providers enrolled. We have plans for even larger mass vaccination sites. We're doing work to get outreach to seniors. As you know, we have the Protect Chicago Plus initiative, which is working to bring vaccine to some of our hardest hit communities and lower barriers. All we need is more vaccine. And to that point, the last slide here, Chicago this week received just 6,000 first doses of vaccine per day, split between Moderna and Pfizer to stretch across the whole city. 6,000 doses per day. There are more than 700,000 Chicagoans eligible for vaccination in Phase 1B, plus the healthcare workers who remained eligible from 1A and non-Chicago residents who may come and work in Chicago. So just to put this in some perspective, that green pie chart, and we will post this online, is the number of Chicago residents eligible in 1B. 360,000 who are 65 and older, and another 350,000 who are those eligible frontline essential workers. And those four little pieces of the pie are the first doses that we've received over the last month. So the main thing we're waiting for is additional vaccine. And as it scales up, I'm very, very confident that we have the tech platforms in place, the providers in place, the planning in place to be able to get it to all of you. So in the setting of improved vaccine availability and rollout, we also are starting to see further improvement in our COVID-19 numbers. And this is really the second part and the major part of the announcement today. So let's just remind ourselves about our risk matrix here. There are four main things that the city of Chicago is following, where we say, what puts us at risk for a potential surge? How do we know if we're in high risk or moderate risk or lower risk? 2 are the ones that we talk about every single day. How many new cases do we have per day, and what's our test positivity? 2 are a little more behind the scenes, but we track them every day. How many people are coming to emergency departments with COVID-like illness, and how many ICU beds are occupied by COVID patients? Chicago Department of Public Health continues to follow a lot of other metrics, but these are the 4 that we've seen are the most sensitive in terms of really being able to identify even the beginning of any possible resurgence. All of our numbers look good, as I'll show you, but it's important that if we started to see signs of trouble, we would dial back so that we don't get into a place, hopefully, where we would need to think about closing things that we've already been able to reopen. And so to just talk you through high level, you see that for each of these 4 indicators, and again, we'll post this online, chi.gov/COVIDVax, very high risk is if we've got more than 800 cases a day of COVID. High risk is between 400 and 799 cases, and right now that's where we are. We've got just over 400 cases. If we can get down to moderate risk, that gets us back under 400 new cases per day. That, if you'll remember, has been our goal all along. This has not changed in terms of national, international, local, for where we are considered to be high risk in terms of when you're out in a setting, how likely is it that you might be exposed to COVID? So our cases per day are in the high risk category still. Our test positivity is now under 5%. It's at 4.7%, which puts us actually into lower risk for that. And then the two other, the emergency department visits and ICU visits, are both at moderate risk. And I'll just show you the graphs here quickly. So related to cases, we're doing very well. We're at 466 new cases per day. We were over 600 just a week ago. As soon as we can get back down under that 400 case per day, we'll be back to moderate risk in terms of cases as a city. Our test positivity now under 5%. We've held there 3 days. It's looking good. That is below our goal for that lower risk state. And then the two others, you can see we're at 148 people in ICU beds with COVID in Chicago hospitals. We're in a moderate risk state there. And then our emergency department visits, we've got about 69 people coming in a day with what looks like COVID-like illness, also moderate risk. And so putting all of this together, we are at a point where it is safe to take some more gradual reopening steps. We've thought about not just the very next step, but what is the path moving forward. And so indoor service at bars, restaurants, and events can expand to the lesser of 25% capacity or 50 people per room or floor effective tomorrow, February 11th. That's an expansion from a 25-person capacity to a 50-person capacity, and that is because we are making good progress. We'll be able to ease restrictions further as soon as all of those metrics are in the moderate risk category or below, which means when we can get our average case number down under 400 cases per day. Again, we were over 600 just a week ago. We're between 400 and 500 now. We're getting close. And so once our metrics are all in the moderate risk capacity, we will be able to expand indoor capacity to 40% at those bars and restaurants. And then looking ahead, as long as we're able to hold at a moderate risk or low risk, we will then be able to expand to 50% capacity after 2 weeks, one incubation period. So I'm very hopeful that just over the next few weeks, if we continue to see the progress that we've made already, we'll be at a point to be able to move to a 50% capacity. Our epidemiologists will continue to monitor this. We're going to do it. You've heard us talk about using a dial and not a light switch here. We're going to take gradual steps, make sure we don't start to see problems, and then make another opening. All things are looking good right now here in Chicago. The fact that we've gotten a lot of vaccine into high-risk settings, like long-term care facilities, like some of the highest-risk occupational settings, already we're starting to see decreases of cases from those settings. Those, in turn, will make our metrics continue to improve. But please do not mistake good news for COVID is over. We need you to continue, now more than ever, wearing your masks, social distancing, washing your hands, and please educate yourself so when you have the opportunity to get the vaccine, you're able to be vaccinated with confidence. As more vaccine gets here, we're going to have more and more opportunities for more Chicagoans. All vaccine is free of cost, and by later this year, every Chicagoan who wants a vaccine will be able to get one. And with that, I will turn it over to Rosa Escareno, again, the Commissioner of Business Affairs and Consumer Protection, who is going to talk more about some of those reopening metrics.
Thank you, Dr. Arwady. Good afternoon. My name is Rosa Escareno, and I'm the Commissioner for the Department of Business Affairs and Consumer Protection. 3 months ago, I stood here with Mayor Lightfoot and Dr. Arwady as we faced an alarming and deadly second surge of the COVID-19 pandemic. At that time, we had no choice but to impose strict regulations on businesses in order to save lives across our city. Asking businesses, especially the bars and the restaurants, to close down after months of open operation was extremely difficult. Certainly for them, for my department as well, as we deal with businesses every day, especially around the holidays, we know that they took a really hard hit. So as always, and our business community has continued to step up. They have continued to stay the course with us and do the right thing for Chicagoans. I know that these last few months have been incredibly challenging for our business community, and I want to thank each and every business that continues to make those sacrifices and continues to do what is necessary to protect their employees, their consumers, and our residents. And I am thrilled that we are here today facing a much brighter outlook for the ongoing fight against COVID-19. But make no mistake, as Dr. Arwady has made it very clear, we are far from this pandemic. It is deadly. It is still here and present. That is why, while we are easing restrictions and releasing a path to the 50% indoor capacity, we are doing so cautiously and slowly, with important regulations remaining in place. I know how painful the closing of indoor dining in the fall was for all of our businesses, but specifically for the restaurants and the bars and the taverns. And the recent opening, releasing the lever just recently to 25% was a relief. And now, today, it's important to ensure that we continue to support our businesses as we increase that indoor capacity to the lesser of 25% or 50 people inside a business establishment, whichever is lower. Specifically for our bars and restaurants, this continues to be a critical and important move. And so we are happy to announce that we will continue working with them. However, I want to remind that with that, we must proceed cautiously, and also remind that there are other regulations that we announced a week and a half ago that remain in place, including the following: no more than 6 people per table, 6 feet between tables. Patrons must also be seated while drinking, eating or drinking. Bars that don't have food must have a food partner in place and make food available at all times in order to take advantage of this indoor capacity. And alcohol service must end at 11 p.m. and all patrons must be out of the locations by midnight. As Dr. Arwady mentioned, after 3 days at the moderate risk level across all 4 metrics, we will be able to expand indoor dining capacity to 40%, and we are very hopeful. So thank you to our business community, because it's because of your support and your collaboration we have been able together as a city to bring those numbers down, and they continue to look extremely good. So I ask you to stay the course. And again, as Dr. Arwady stated, we will continue to stay at that, if we continue to stay at that moderate risk level, all 4 metrics for 2 weeks, we may be able to move to the 50% capacity. So this is a clear path that will provide important predictability for businesses. And one of the things that I'm hearing from our business community, predictability into how to continue to open is essential and important. So today's announcement by Dr. Arwady in terms of setting the tone and understanding how we're progressing gives our businesses the opportunity to actually plan ahead. So as we work to continue to cautiously reopen, I want to remind all businesses that my department, BACP, will continue to monitor and enforce the regulations. And we must work, again, cautiously and together to reopen, and we will, again, while the enforcement is intended to address the regulation, our primary focus is not to be punitive here, but to be educating and creating awareness for our business community. 2 weeks ago, we announced that our department expanded our active compliance program. And what that is that we visit businesses for non-disciplinary consultations to help them understand how to navigate and comply with the constant changes that have come about. Our business community often is a little bit confused about what the regulations are, so we are proactively going out into the commercial corridors and providing that information in person. We're doing workshops and webinars to ensure that we're bringing this information, and we're sending thousands of emails to our businesses and licensees to ensure they have the information. So I certainly expect a high level of compliance that has continued since the pandemic nearly a year ago, so that we continue in this path. And since March, we have conducted about 8,000 investigations, and I just want to remind all of you that we've actually only issued citations to about 5% of those businesses that are investigated. And we stand here today very hopeful after so many challenging months, and remind all the businesses and residents that as we continue to open, and as we look at Valentine's Day approaching, and as we celebrate Black History Month, I want to encourage all of us to work together to support the local businesses. They've been struggling, and they are doing the right thing. And so I ask you to keep all the safeguards in place as we continue to open and support our business community and our workers, as all of this is essential to the growth of our city. And now it's not the time to think that, as Dr. Arwady said, that COVID is gone. COVID is still here, but doing it safely, we can continue to open our city into the months ahead. So I want to thank, in conclusion, I want to just thank the mayor and Dr. Arwady for their leadership in taking Chicago through this important course and in saving lives and reopening. And together, I think we're going to see certainly a brighter future ahead for our businesses. And now I would like to welcome Dr. Rachel Rubin, Senior Medical Officer and co-lead at the Cook County Department of Public Health, to give some remarks. Thank you.
Good afternoon, and thank you, Commissioner Arwady and Ms. Escareno, for allowing me to join you here today. And so I am Dr. Rachel Rubin, Senior Medical Officer and co-lead at the Cook County Department of Public Health, which is the certified local health department for most of suburban Cook County. On behalf of President Tony Preckwinkle and with my co-lead, Dr. Kiran Joshi, I am pleased to be here today and pleased to align our approach with the Chicago Department of Health and the Stickney Township Public Health District to provide a measured, careful approach to reopening our region. We are making real progress, not as quickly as everyone would like, but we have vaccinated over 25% of the 65 and older population so far. The number of people who have received at least one dose of vaccine will pass our total number of COVID cases, an early but important mile marker in this effort. Every day we look at the data to determine how equity vaccine is being administered, and we let that information guide our decision-making so we can ensure an equitable application. We are listening to and speaking with underserved communities about their vaccine hesitancy, and we will be rolling out several new efforts to give people the information they need to make the best decision for themselves. And we know many communities simply do not trust government, and with good reason. It is our challenge and our job to win back that trust, and we look forward to working with those communities further. All that said, we are moving to a good place, but we must keep wearing masks, keep 6 feet from each other, and obviously wash our hands frequently. Examining the data and lessening mitigation slowly, especially in a changing environment with new, very transmissible variants of the virus being identified in our region, is going to be key to our success. We all want to be able to gather with friends and enjoy time together. We must adopt an approach that couples that desire for communication and connection with caution. We do not want to experience resurgences in infection, and we are glad to be able to loosen restrictions, but safely. A singular approach for almost all of Cook County, the city and the suburbs, means that we are all moving together to open up while considering the safety of our most vulnerable among us. And now I would like to turn this back to Ms. Escareno for some comments in Spanish. Thank you.
Thank you, Dr. Rubin. Buenas tardes. Mi nombre es Rosa Escareno y soy la comisionada del Departamento de Asuntos Empresariales y Protección al Consumidor. Hoy anunciamos la ruta y el camino para aumentar la flexibilidad de las regulaciones de COVID-19. Ahora que estamos fuera de las mitigaciones impuestas por el Estado, el Departamento de Salud de la Ciudad de Chicago ha establecido 4 métricas que se utilizarán para determinar cómo aliviar las restricciones. Las métricas son total de casos, tasa de positividad de casos, visitas diarias a la sala de emergencia y camas de unidad de cuidado intensivo. Hoy estamos en el nivel de riesgo moderado. En todas menos una de estas métricas estamos en ese riesgo moderado. El total de casos actualmente son de 466 y para llegar al riesgo moderado en esta métrica necesitamos estar a menos de 400 casos por día. Mientras aún no estamos en el punto en el que podemos aumentar esta métrica, comenzando mañana, aumentaremos la capacidad de comedor interior al menos de 25% o 50 personas en los bares y los restaurantes. Todas las demás regulaciones permanecerán vigentes, incluyendo lo siguiente: no más de 6 personas por mesa, 6 pies entre cada mesa. Los clientes deben estar sentados mientras comen o beben. Los bares que no sirven comida deben asociarse con un establecimiento de comida y proporcionar comida a todo tiempo mientras están abiertos. Y el servicio de alcohol debe terminar a las 11 de la noche y los clientes deben estar fuera de los sitios del comercio antes de la medianoche. Como ha mencionado la doctora Arwady, después de 3 días en el nivel de riesgo moderado, en las 4 métricas, podremos aumentar la capacidad del comedor interior al 40%. Estas son noticias muy elevadoras para nosotros e importantes. En este momento podremos considerar aumentar el límite de personas a 50. Entonces, cada día estamos abriendo la ciudad mucho más porque estamos siguiendo los reglamentos a utilizar las máscaras y como la doctora ha anunciado el progreso de las vacunas en la ciudad de Chicago. Entonces, el anuncio importante es de que hay que seguir con las protecciones porque nosotros queremos seguir abriendo con un camino hacia el 50%. También consideramos alivios adicionales de las regulaciones en este punto. Pronto habrá más información sobre cómo llegaremos a abrir al 40% y después a más de la capacidad de 50%. Mientras trabajamos para continuar con la reapertura cautelosamente, quiero recordar a todas las empresas que mi departamento, BACP, continuará haciendo cumplir con los reglamentos. Sin embargo, nos estamos enfocando principalmente en educar y alcanzar con información, asegurando que los empresarios sepan cuáles son las reglas. La disciplina se va a reservar para esos empresarios que están quebrando las leyes y que son un problema. Hace más de 2 semanas abrimos un programa de cumplimiento activo para asegurar que estamos proveyendo información a los empresarios y informándoles de los reglamentos sin ninguna infracción. Mientras estamos aquí hoy, tenemos esperanza de que vamos a seguir abriendo, pero tenemos que seguir haciendo lo correcto. Como la doctora ha mencionado, hay que seguir utilizando las máscaras y tomando todas las precauciones para asegurar que podemos aumentar los números de capacidad adentro de los establecimientos, principalmente los restaurantes y las barras. Ahora quiero darle las gracias al alcalde Lightfoot y a la doctora Arwady por por su liderazgo y por seguir manteniendo a nuestra ciudad protegida. Muchas gracias y ahora le voy a dar el micrófono a la doctora Arwady.
Thank you to both of you. We can take questions for any of us.
Dr. Arwady, there's already reaction from the Chicago Restaurants Coalition, and they are expressing disappointment in Mayor Lightfoot's decision today not to increase restaurant indoor dining to 50% capacity in time for Valentine's Day weekend. Do you have anything that you want to say to them?
Sure. My goal is to make sure that we can get restaurants open safely in a way that does not lead to us needing to close them again. And the issue is, we still are at a high-risk state for COVID. As this is measured nationally, internationally, locally, those metrics have not changed. If you recall, over the summer, we were using the same metrics. We were aiming to stay below 400 new cases per day, and our goal was to be below 200 cases per day. I know we're a lot better than we were just a couple of months ago, but we're still at a high-risk state. Our positivity is looking relatively better, but we're just under that 5%, and a lot of that positivity improvement is because our testing capacity has really increased. The risk, though, remains high, and I'll remind you that although our restaurants have been doing a great job of abiding by the COVID restrictions, when you're in a restaurant in particular, you have to take off your mask to eat and drink. By definition, you're gathering sort of in close quarters. And the evidence suggests that there is some more risk in those settings. My goal is to move as quickly as it is safe to move and not to get into a situation where we have a third surge here in Chicago. You've heard us lay out a path toward that 50% that I think we could move over just over the next few weeks as long as the numbers keep looking good. And that is honestly as safe, as quickly as it is safe to move. So I hear, I feel like all I do right now is sort of say, no, not yet, just wait. We're moving as quickly as we can, and all the numbers are looking good. So as soon as we can get into moderate risk, we'll go to that 40%, and as long as we can stay there for one incubation period, we'll go to 50%.
Doctor, another question from Alex Nitkin from the Daily Line, and he has a question. He says, the City Council's Health and Human Relations Committee is scheduled tomorrow to vote on an ordinance that would reconstitute the city's Board of Health and change some of the legal language around your powers as commissioner. What will this ordinance mean for the city's public health system, the city's efforts to stop COVID, and your role as commissioner?
Sure. So really the goal of that, and we're doing this really with support of the board president, it's been in conversation, is to really modernize in a lot of way what the Chicago Board of Health its composition. So it's one of the very few boards in the city right now that doesn't have any terms, for example. So we really appreciate the people who have been on the board, but we do have people who have been on the board since the early 90s. To pull more sort of in line with changing priorities, we are going to be putting 3-year terms in place that can be renewed. So it's not that we're looking to vacate the board, but we want to make sure that we are considering changing needs. For example, and there's also some more requirements around diversity, including diversity of expertise. So, for example, I love the folks on our board, but we don't have anybody with any behavioral health expertise. We don't have anybody with any environmental health expertise. We don't have anybody who represents our federally qualified health centers, who are our major partner in the clinical space here in Chicago. And so There's some new language that really lays out what that composition of the board should look like in terms of really reflecting needs in Chicago and recognizing that it's possible. Federally qualified health centers didn't exist 30 years ago, but it's important that they're represented. And related to the question about the sort of the powers, it's really about clarifying the roles that the board and the health department play related to rulemaking. So it's not that I am getting any additional powers. It's that right now, in many cases, both the board and the health department in the code are granted the same the same ability to do some rulemaking, but the Board of Health has not made rules, right? The Board of Health predates the city of Chicago. It goes back to the 1830s, and where the board has promulgated rules in recent decades, it's been put together by the health department. And these are around things, we actually look back to see what some examples were, and it was things like tanning, minors' access to tanning, for example, or release of medical records. And so it's the goal is really to clarify the role of the board and bring it really up to date with current needs.
Dr. Arwady, another question. This is from Univision Chicago, Vanessa Navarrete. She says, we heard a lot yesterday about people who don't live or work in Chicago signing up for vaccines meant for people who live and work in the city. Any idea how many vaccinations have gone to outsiders, and what's the plan that you have to stop this from happening?
Sure, and thank you for that question, because I do want to clarify, and my counterpart from Cook County Department of Public Health, we talk a lot about how to be coordinated, in this response. We've also talked about it related to vaccine, and the fact of the matter is, a lot of people move between the city of Chicago and suburban Cook County, and we don't want to set up a situation where if somebody works in Chicago especially, we say, sorry, you can only get your vaccine, if you also live here. So what we have now, and just to put this in some perspective, 37% of the vaccine that the city has administered at city sites has gone to non-Chicago residents. But I also want to specify that of all of the Chicago residents who have been vaccinated, 25% of them have been vaccinated outside the city, for example, in suburban Cook. So it does move both ways. We are working especially to make sure that people are affirming their eligibility appropriately. This is really meant to be for people predominantly who live in Chicago or if they work in some of the higher risk settings that have been defined. We've heard loud and clear that there are concerns about asking for official identification related to immigration and other reasons, but we are exploring other ways to ensure that these vaccines are going to the population for whom they are intended. But we do intend to keep collaborating and make sure, and with the state as well, if there's need to be shifting vaccine or thinking about how we prioritize across that, I think that's an ongoing conversation.
Alex Fisher with NBC Chicago, he's got several questions. Let me ask you a couple first, and then maybe I can follow up with the others. Will the city move back Phase 1C? And if so, when will that decision be made? The CDC is now saying 2 masks are better than 1. Do you recommend people wear 2 masks?
Okay, so related to 1C, just so everybody is aware, we've set a tentative date for 1C as March 29th, with a recognition that December, January were predominantly about vaccinating 1A. We moved into 1B at the very end of January. February and March, predominantly about vaccinating 1B, and we expect at the end of March to move into 1C, and then have April and May be the predominant time when we're vaccinating in 1C, and then really the end of May be when we move into the broader, general population. All of that is dependent on our vaccine supply, though. And so the reason we've set those as tentative dates is because if we were to really not have gotten through a lot of our 1B population, it's possible we'd have to push it back. I'm continuing to feel pretty optimistic that probably by March we will be getting quite a bit more vaccine here. If we see a third vaccine approved, we're hearing a lot about increased production at the federal level. Again, we have all the systems in place and we have good efficiency for pushing our vaccine out. So at this point, we are not planning to make adjustments to those dates. We would update it as needed. Again, our goal is to get people in as quickly and efficiently as we can within the groups that are already prioritized in 1B.
And have you had a chance to look at what the CDC said about the 2 masks? Is that something that you would recommend at this point to the people of Chicago?
Yeah, so I actually want to look at that exact detail related to what the CDC has put out. I always like to make sure I've understood, the evidence that's going into any particular recommendation before I sign in one way or the other. But what I will tell you is that the most important thing by far is that people actually wear their masks and do the distancing and wash their hands. And certainly there's been a lot of conversation about doing additional masking, et cetera. If the CDC has put out guidance that's clear about that with the details on it, we'll review that and then bring it in some detail the next time that I speak publicly. But the most important thing, do the things that we already know work.
2 quick follow-up questions. Alex Fisher, is the city considering the United Center for Vaccinations? Also, Wrigley Field, would the city pick that venue? Although parking is limited there.
Yeah. So the city has looked at those and probably every other large venue that you can think of in Chicago. Yes, we have looked at those settings. We have looked at other large settings. We actually have plans already made to think about these really mass vaccination sites where, for example, maybe you could move 5,000 people through a day. But again, we're only getting 6,000 doses a day here in Chicago. And so this is not about not having kind of planning around that. It's about needing more vaccine. I do very much anticipate as more vaccine is available and as the weather warms up and we're able to take some more advantage of outdoor locations, particularly for that observation time that comes after people get their vaccine, that we'll have many more opportunities like that. We've already, even in our flu clinics last fall, we trialed drive-throughs, we trialed walk-ups, we trialed mass vac sites. So we've looked at those sites and more, and I'm confident that those sorts of sites will be part of our planning. We've also put in some requests to the federal government through FEMA to think about also staffing up some of those larger mass vaccination sites, especially if they come with vaccine.
And Doctor, this question comes from Fox 32, and the governor announced today that he's expanding Phase 1B to include people under the age of 65 with diabetes, cancer patients, on February 25th. With so many people in Phase 1B unable to get an appointment, how will you be able to handle this? Is there a plan to ensure that people living in the city and working in the city get the vaccines meant for them?
Yeah, so I did hear that this morning. We are looking at the possibility here. Of course, I would like more people to be able to be vaccinated. But that pie chart that I showed you, we've only gotten enough vaccine to do 5 to 10% of all of the people who are already eligible. And the reason why we've looked really toward the end of March is based on where we expect us to actually have more vaccine. I think it would be very appropriate if there are parts of the state, for example, that maybe are already through their 1B. They've gotten all their folks over 65. They've gotten their essential workers. If there is anywhere in the state that has vaccine appointments going unfilled, of course that would be appropriate to move ahead. But here in Chicago, if we add additional people right now to 1B, all we do is make it harder for the people who are already eligible to get that vaccine. And it would make it harder for us to get it to the people over 65. It would make it harder for us to get it into the hardest hit communities because it just dilutes the amount that's available. So we'll have some more conversation, certainly with the state. If they have gotten some assurance that there will be additional vaccine and they could direct it towards Chicago, that would be very helpful in terms of us being able to more quickly move ahead. So I think more to come there, but I want to be really careful about not opening up the number of people eligible for vaccine when I don't have anywhere near enough vaccine. Our estimates are that more than 900,000 Chicagoans would fall into that 1C group, and that would more than double the number of people that are already eligible. 6,000 doses of vaccine a day just for me doesn't match up against our ability to do that just yet. So certainly more conversation to come. I'm hopeful that perhaps they've got a line on additional vaccine and may be able to direct it towards Chicago.
Dr. Kelly Bauer with the Block Club has a couple of questions. First question is, will Chicago expand 1B eligibility to people with underlying conditions as Illinois is doing later this month?
Yeah, that's sort of that same question. At the moment, again, with the amount of vaccine that we have, we remain very focused on getting those over 65, those in the communities that are driving our COVID outbreak, making sure that they're getting access. We will have some more conversations, and again, if we're able to get additional vaccine, we may be able to move sooner than expected.
And Kelly Bauer has another question. She heard reports of a young woman who became ill for about 2 days after being vaccinated. She said the side effects were worse than when she actually had COVID. What are the worst side effects people are reporting after being vaccinated in Chicago, and how common is the experience to have these severe side effects?
Yeah, so most people do not have severe side effects. Let's be really clear about that. When I got the vaccine myself, I really had no side effects, a little bit of a sore arm. We do see people, though, and we saw this in the trials as well, sometimes feeling tired, having headache, sometimes having a low-grade fever or muscle aches, and it sounds like that's what this woman probably had. When we see that, it typically lasts 1 to 2 days, and that also sounds consistent with what this person had. I don't know anything about this person. My guess is she's probably, she may be younger and having a more robust immune response. And sometimes when we see people having more side effects, it's just their immune system sort of really learning that lesson well in terms of being able to protect themselves against COVID. We know that people are less likely to have those side effects as they get older, but the protection is the same, regardless of the side effects that somebody has or does not have. So I really want to underscore that if somebody has side effects, in most cases they are mild. And you can take Tylenol, you can take ibuprofen if you need to, but they are not, it is impossible to get COVID from the vaccine, and these are not long-lasting or dangerous in any way.
WTTW, Heather Sharon has a couple of questions. Her first question I think you've already answered about Governor Pritzker and people with serious disease, underlying conditions. Mm-hmm. Her second question, the governor said that Illinois is getting 30% more vaccine, including 5% more this week. Is that also true for Chicago?
So last week we were getting 5,700 first doses per day. This week we're getting 6,000, which is an improvement. We've heard that we may be getting a small amount more vaccine. We heard next week, for example, across the whole week, I believe it's going up about, I don't have it in front of me, but it's in the sort of 2,000 to 3,000 dose range. I think we're seeing improvements. We've been seeing improvements each week. If you go back, a couple of weeks ago, we were getting less than 5,000 doses. But when I talk about really getting enough vaccine, I'm not talking about another 1,000 doses a day or 2,000 doses a day. I'm talking about seeing our supply double, triple, quadruple. And if that can happen, we'll be able to move even more quickly.
One more question from Alex Nidkin. He's asking if the city's testing volume has been steadily declining for the past month, from almost 15,000 tests per day in early January to about 12,000 tests per day now. Is the Chicago Department of Public Health doing anything to reverse that decline?
So this is one of the most interesting things that we've seen in the data here. Our epidemiologists have really been struck by how closely testing demand matches our epidemiologic curve when we're seeing cases. If you think about this, when there are more cases, there are more people with symptoms, there are more people with exposures, and we see more people seeking testing. It's actually been really striking, if anybody wants to look at the details here, to see in both of our surges how well the cases and the positivity track together, and it's why we always look at those metrics together. If you just used positivity, it would be very reflective of the amount of testing that you're doing. Cases and positivity have to be looked at in conjunction because it's the two together that lets you know how you're doing as a city. So our testing volume is down just a little bit, but we're not concerned about that because it's right in line with what we would expect given the burden of cases and our positivity.
We've gone through most of these questions. I had a question for Dr. Rubin, but then there is an off-topic question for you, Dr. Arwady. You want to take that after Dr. Rubin or whatever you prefer?
Yeah.
And Dr. Rubin, I just wanted to ask you, you talked about Cook County aligning with the city of Chicago, and as far as restaurants in Cook County, so you're basically going to be following the same recommendations that the city has outlined today about gradually opening access to restaurants. Could you talk about that a little bit in Cook County?
Yeah, sure. So we are also moving tomorrow to allowing 50 individuals to go into any single restaurant or bar, but maintaining that as a 25% capacity, whichever is the lowest number, as Dr. Arwady has explained for the city of Chicago. And we will also be reviewing these metrics. We review them on a daily basis, but in terms of a ability to shift or deciding to shift to even more opening up will probably occur about every 2 weeks or so, to do this as gradually as we think is appropriate and safe. And in terms of our metrics, in terms of driving those changes, it's very similar or practically in alignment with the city in that we are in the moderate level risk for the number of new cases we're seeing every day, our ICU rates, our hospitalizations that we are seeing for COVID-related diseases. And we are, as of last week, not the first few days of this week, our daily average on a 7-day rolling average was about 412 new cases a week. So that means a day. So that means that that's still in the high risk category, while the other metrics are in the moderate risk category. So it's very similar to the state. So since to the city. So therefore, since we've been in alignment with our metrics and we look at these things in an evidence-based manner, we are moving in a fairly lockstep process with the city. Our city and the suburbs, we're really all one community. People dine in the city when they live in the suburbs and vice versa. And people celebrate and have events in the suburbs when they live in the city and vice versa. People shop in the city and the suburbs, et cetera. And so it didn't really make much sense to have this artificial line that separates the city from the major suburbs to have different sets of restrictions. And so it's important that our metrics are in alignment, and then therefore our restrictions and our easing of those restrictions are also in alignment.
Thank you, Dr. Rubin. And Dr. Arwady, is it okay? I think that's all of the questions about the latest on COVID-19, but there's an off-topic question. Sorry, give me one moment. I lost it here. Mm-hmm. Okay, here it is. This is from Ryan Burrow, news director at WGN Radio. At least 4 people are taking part, he says, in a hunger strike related to the permit application for RMG General Iron. What role is the Chicago Department of Public Health playing in reviewing that application? Where are you in the process? Do you have a message to these groups who feel that General Iron will be putting harmful chemicals into the air of the community?
Yeah, so the Chicago Department of Public Health, like many other departments at the city, has to review permit applications when businesses want to operate. And I know that this is one of the applications that has been put forward for operation, and I know that there are folks on my environmental team who are reviewing that application. I can tell you that an initial application was put forward. There was a public comment period and a lot of comments, a lot of strong opinions opinion about this. And the team did identify actually quite a number of deficiencies in the application that had been put forward. It was returned to the applicant. The applicant has resubmitted, and the team is again reviewing that application. The Chicago Department of Public Health has to look to see whether any applicant is meeting all of the requirements that are in place, including the environmental requirements to be able to operate. And so that's the stage that it's at. My understanding is that when that review is finished, there would be another opportunity for public comment. I know there are lots of strong feelings about this, and certainly, you know, the Chicago Department of Public Health cares a lot about having healthy environments. We also have to make sure that we follow the laws and the requirements that are in place related to business operations. So my team is in the middle of reviewing that, and I want to thank everybody who has put in comments, public comments, related to this process.
Okay. Thank you very much.
Thank you.